Henry Brodaty, Professor of Aging and Mental Health, Director of the Dementia Centre for Research Collaboration and Co-Director of the Centre for Healthy Brain Ageing, all at the University of New South Wales. I'm really excited by the increased impetus for prevention of dementia or delaying the onset or risk reduction. The evidence has been accumulating a lot in the last few years, and there are a number of trials underway to prove that by people engaging in healthy diet, physical activity, mental activity, social activity, and managing other risk factors, they can maintain cognition with aging for longer. We're doing such a trial, Maintain Your Brain, and I'm really excited by that because it's the largest internet-based trial for this purpose in the world. So we ran a drug trial centre for over 25 years at Prince of Wales Hospital. And we actually folded up our operation 5 years ago because we had trouble with recruitment. The criteria for recruitment in drug trials have become more and more stringent. We have to screen maybe 100 people to find one person who meets the criteria. It became unfinancial for us to continue, and sadly we had to close our drug trial centre 5 years ago. It's becoming an increasingly burdensome task in recruitment, and to have trial-ready subjects available for studies would really advance the field. Pretty well all the research is on trying to find treatments or cures for Alzheimer's type of dementia. And because there are possible side effects for some of these drugs, it's important to screen out those who may be susceptible to that, and to make sure that the people involved truly have got Alzheimer's disease, because we know that a substantial proportion will have a dementia, but the diagnosis of the type of dementia, being Alzheimer's, may be inaccurate. So they need to have evidence of the amyloid plaques in the brain. They need to have evidence clinically of Alzheimer's disease. They sometimes need to have cerebrospinal fluid, the lumbar puncture or spinal tap, to assess whether they have the protein structure which is typical for Alzheimer's disease. There are certain eye conditions, skin conditions, or history of stroke or evidence of vascular disease in the brain which are contraindications. So that's why the bar has been set higher in recruitment. StepUp will be a major benefit for researchers. For example, we're interested in doing a study looking at how people might want their behavioural issues managed should they develop dementia in the future. And we as clinicians have ideas about it, but we don't have the views of people, what they would like. And so by linking with StepUp, we could access a population ready to talk to us about it. We're establishing an Alzheimer's dementia registry in Australia, and it would be a marvellous way to recruit people who would like to participate in that. We do a lot of research in nursing homes, trying to improve diagnosis management, and we're also doing a study in primary care trying to improve diagnostic process and post-diagnostic support. But we need to co-design these studies with people who are affected, people who have views about it, not just what we researchers think, but what the public thinks, particularly those affected. And StepUp would be a really valuable tool to be able to recruit people in that way. We know that people are really worried about dementia. When we do surveys of older people, they used to say what worries them most. They always said health was what worried them most. They always used to talk about cancer. Now they talk about dementia. It's the major concern. In my age group, my friends say, Henry, hurry up, you need to find something to help us. And so this gives the opportunity for people to join in dementia research enterprise from an altruistic way and in a personally selfish way to try and improve dementia research, to try and find those ways to prevent it, to treat it, to better care for people. And that's why StepUp will be a valuable tool for all of us, not just for researchers.